on your right shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen, and we're just getting our first good look inside the joint here. We've got some fraying at the biceps anchor, which is what we expected. Hey, Lauren, pull this bipolar. Pull it out. Let's just take this closer now. Okay, just hold it there. Okay, so we're going to put our shaver in. And here we can have a look. We can use it as a probe as we plug in the shaver, so it'll start to work. And we can see here that this biceps anchor is quite a bit torn. And so that's what I think would qualify as a type 2 slap lesion. You can see all that. And additionally, you've got some damage around the front. You didn't have any instability on exam, but you've certainly got that issue. Now we're going to look at the cuff because we were curious about that. We'll show you some more of that in just a minute, but it looks like there is a partial tear in the cuff here as well. Now we've got a little bit of suction on the shaver. How's this pressure, Leo? Huh? All right, yeah, we got a long way to go. So we're going to go ahead and continue to breed a little bit of this labrum. And that looks like a smooth edge there. We're going to be releasing the biceps for sure. Before we do that, I wanted to look at this rotator cuff. And you can see you've got this interesting injury here. You've got a little area where it tried to heal, but essentially you do have a complete cuff tear. I'm going to take down this little bit right here because it's essentially of no value as far as cuff tissue. And once we do that, we're going to be able to see that you've actually got almost a 90% cuff tear, if not a small full thickness tear. So we'll get a rotator cuff anchor. We're going to put a stitch through the biceps and repair that using a what we call a suprapectoral technique, using a pop lock suture anchor. And we'll show you how we do all that in just a second here. We've got a little more fraying in the posterior labrum here, but we're going to put the camera in the front and have a look from the front to the back. Okay, so now we're just passing a spinal needle right through the biceps. There it goes right there. We're going to pass the shuttle relay through. We'll use a grasper. And now into that relay, we're going to load a stitch. And now to complete this, we're going to pass a second time through the tendon. That looks like a pretty good shot there. Feed that wire through it again. And we're doing this just to secure the tendon. It's kind of a temporary fixation because we're going to use a suture anchor later. All right. And now the trick here, if you watch closely, we're going to back out. We're going to take the cannula around the backside of the biceps tendon like that, and now we're going to retrieve the relay. That gives us what we call a loop stitch, or a purse string stitch around the tendon, which gives us a real secure hold on it. See there, now that biceps is held pretty securely by that stitch. We'll take a pair of scissors and release it. Okay, and now it's released. And I think now we can see how that biceps, now that it's released, is no longer going to pull on the labrum. And that shouldn't be a problem going forward. There's still some labral tearing in the posterior part of the socket. I want to see if I can debride a little bit of this here. So now we're passing a needle through the area of the cup that's torn. See right here? You can see it's super thin there. We're going to go ahead and pass a marker stitch. Careful. And this is a purple stitch. It's not permanent. This is just so we can find this area very quickly once we change positions with your shoulder here. Okay, so now we'll go off on the video for a minute.